everyone. I am very grateful for the opportunity to discuss our study. So many thanks to the faculty and the organizers. I am a medical oncologist and a PhD student at the University of Modena and Reggio Emilia. And this is the title of my abstract, Prognostic Impact of ABCA1-G1 Expression, Lipid Parameters, and Nephrectomy in patients with renal cell carcinoma receiving immune checkpoint inhibitors. I have no conflicts of interest, so let's start from the rationale of our study. We know that the advent of immunotherapy significantly improved the outcomes of patients with metastatic renal cell carcinoma. However, many patients still do not achieve durable responses. In fact, there is a strong need for reliable prognostic biomarkers. Previous evidence suggested that many factors may have a role, including higher cholesterol level and lower triglycerides levels. Additionally, also the way cholesterol is transported within cells may play a role. In fact, higher passive diffusion is being related to better outcomes, whereas higher active diffusion via the cholesterol transporters ABC-A1 and G1 was related to poorer outcomes. Finally, the controlling nutritional status, which is a tool to detect malnutrition and includes serum albumin, total lymphocyte count, and total cholesterol, has been demonstrated to be a prognostic factor in patients receiving immunotherapy. Based on this evidence, we developed the CHOMET study, which was a retrospective single-center study enrolling patients with advanced renal cell carcinoma treated as a first-line therapy with immune checkpoint inhibitors combinations. The primary objective was to describe the expression of ABCA1 and G1 on tumor tissue, while the secondary objectives focused on exploring the impact of prognostic factors such as the ABCA1 and G1 expression, the lipid levels, CONOT score, and the nephrectomy status. So let's go to the results. We enrolled 86 patients, and we described the ABCA1 and G1 expression on 50 and 55% of patients, respectively. Additionally, we classified patients in 3 groups according to the ABCA1 and G1 immunohistochemical staining intensity. Interesting, we saw that patients who underwent nephrectomy were characterized by higher total blood cholesterol levels. For this reason, we combined these 2 elements in a nephrectomy-cholesterol score, classifying patients in 3 groups according to the absence or the presence of 1 or 2 of these factors. So let's go to the outcomes. With a median follow-up of 30.4 months, the median progression-free survival was 25.6 months, while the median overall survival has not been reached yet. And what about the prognostic factors? As you can see in the curves, patients with higher ABCA1 and G1 staining intensity were characterized by worse outcomes, both in terms of PFS and OS, and both for ABCA1 and G1. And these results were statistically significant. Regarding the lipid levels, we saw that patients who had higher total blood cholesterol or higher total triglycerides levels were characterized by better outcomes, although not reaching statistical significance. Regarding the nephrectomy-cholesterol score, we saw how our score was able to stratify patients, and patients who had both received nephrectomy or had higher total blood cholesterol levels were characterized by better outcomes in terms of PFS and OS. Finally, we confirmed the role of the CONOT score in stratified patients, and patients with higher CONOT score and higher levels of malnutrition were characterized by worse responses to immunotherapy. And all of these results were statistically significant. So in conclusion, we described the ABCA1 and G1 expression on renal cell carcinoma tissue of our patients, and we saw that there was a relation between lower ABCA1 and G1 staining intensity and better outcomes. We found a trend of correlation between higher cholesterol or triglycerides levels and PFS and OS. And we describe a relation between nephrectomy and higher blood cholesterol levels. We combined these 2 elements in a score, and the score was able to discriminate our population. Finally, we confirmed the role of the CONOT score in patients receiving immune checkpoint inhibitors. Thank you so much for your kind attention.